My name is Jennifer Charlton. I'm Executive Director of Mission of Mercy here in the Maryland, Pennsylvania program. And we have been here serving in the Maryland, Pennsylvania area for 20 years. And our mission is to restore dignity and provide healing through love. And that for us is God's love. We are a faith-based organization. We don't proselytize, but who we are when we serve is God's servants serving God's children. We're honored to be here in Harrisburg serving those in need of health care. We provide primary health care, dental care, and free prescription medication. So all of our services are completely free to the patients we serve. Our method of serving is a little bit different than a doctor's office in that we move patients through the system. But yes, we have a registration area, we have a waiting room, we have a triage area where patients are seen to get their blood pressure checked and basic blood panels and things, working with a nurse, oftentimes working with an interpreter if that's needed. And then they go on board the van, the mobile unit, to work directly with a primary care doctor. So we are a volunteer-driven organization. We have about 250 people who are serving in our medical team. Some have medical experience and some are hospitality workers. Whatever their talents are, they want to be here and serve the people who are in need. So here in Harrisburg, we have 25 to 30 volunteers who are from the community who serve with us every clinic day.
Everybody, this is Mayor Pappenfuss. This is our dear volunteers. All right, you can come on back. When we look for a church partner, one of the things we're looking for is do they have this physical space for us to work one-on-one with the clients. This was a perfect layout for us. Also with the new medical van, we needed a space that could accommodate the increased width of the vehicle and height of the vehicle. So the last location did not allow for that. So this has worked out very well for us. You'll notice in here, this is a nurse working with a patient, who is being seen, and they're going through triage and they're looking to see what their blood pressure and all the different things are. Basic blood panels we can do here. We can find out if you've got strep or if you're pregnant or some of those other things for the diabetics. We check their sugar levels and things like that. As you walk down here, you'll see another area that's currently not being used. You can take a shot in there if you want. That's
a lot of space for individual interaction.
Exactly.
Privacy and everything else. It's a
great
layout. Where did you used to be before here in Harrisburg?
We used to be at the St. Francis of Assisi School.
Okay. And
prior to that was the Lutheran Church at 13th and Dairy.
And how long have you been here?
We moved in here January.
January, okay, so fairly recent.
And we knew we were getting the new vehicle, and so there were some changes that we needed to make, and this has worked out very, very well. And Representative Patty Kim was instrumental in helping us find this as our new home.
It's really perfect.
It's perfect.
It's a great location, very centrally accessible, and plenty of room.
So more patients being seen here, and I'd like to show you, if I could, this is our dental suite.
There you go. Okay.
It's currently not manned because we need dentists, and today we don't have a dentist. So we would love your help in doing some outreach to dentists who may feel that they have the time and interest and want to share their talents. We are a word-of-mouth organization oftentimes, but also through county and agency partners. In the safety net. So there may be the health department or other types of agencies that know that we're available to serve primary care. One of the things, though, I want to say that I think is a myth, that whenever you have a free clinic, and we're completely free to the patients, we don't process paperwork, we don't ask people to prove their poverty in order to be seen, because for us, you can't restore dignity if you're asking people to prove their poverty. So this is our new mobile medical unit, and if you had seen the last one, you would be even more impressed because this is wider, it's higher. There's a waiting bench area here, which is very comfortable for our patients to wait on board as they're going to be seen. If you look behind you here, this computer and this gentleman, Bob, is this is Mayor Pappenfuss with Harrisburg, the Harrisburg mayor, and Bob is one of several of our drivers who also acts as our data entry person.
Okay.
So all of the patient information is kept in this computer system. It's all HIPAA compliant, and this is our way of knowing
who the patient is, where they live, their zip code, what kind of services did they get, what kind of medications are they on, so that we can track and measure our impact and results, but also, more importantly, take care of the patient if they have a question or a need.
Got it.
There's a myth that free care must not be very good because you get what you pay for. And in fact, we have doctors and nurses who have spent many, many, many years working in their profession, and they're extremely talented. They're loving, they're kind, they're gracious, and they're here to do God's work and serve people who would otherwise not have access to care. And we like to say that we provide compassionate care. That's sometimes it's a hand or a touch, it's a hug, it's not just the medical care that they need, but the spiritual renewal or the possibility of just a good listening ear to make sure that the people are feeling comforted. This is a doctor working. We have 3 doctor suites, if you will, on board the van. This is the nurse's station where the nurse works with the doctors to make sure that the medications they need are properly dispensed and the records are properly kept. We do keep a paper record as well that is proper for any court needs, that if a patient's applying for disability or anything like that, all of that is recorded in a way that we can transfer records. If a patient ends up getting insurance and moving to another doctor's office, we can transfer those records upon their request.
Yeah.
This lady here, Maureen.
Say that again.
This is Maureen Little.
Good morning.
She's our director of nursing.
Nice
this
to
is
have
one of
you.
our tried and true wonderful volunteers from
you.
Harrisburg.
Hi.
And you live here in Harrisburg, don't you?
No.
Oh, where do you live?
I live down in Emmitsburg.
Oh, you're in Emmitsburg. Okay,
Yeah.
so coming up from Emmitsburg. So we have we're a volunteer-driven organization. We'll have 250 volunteers serving in our medical team throughout our footprint. Some are coming from far away, like Emmitsburg. Others live right here in the community. For the most part, the volunteers come from within the community and serve the community through Mission of Mercy.
Can I ask why you volunteer?
Because I just like to do it. I've helped the patients a lot. I love to see some things that are going on with the patients. I do the pharmacy. I've been here 18 years, and I've been to multiple sites.
Okay.
Pretty much all of our sites I've been to.
So the other thing with our volunteers is they love Mission of Mercy so much they don't leave. So a lot of times,
18 years.
and we're so glad, because then they also develop a relationship with those patients, that they know them, they understand their needs, not only medical needs, but the socioeconomic needs, what they're dealing with, because a lot of these patients are either living in poverty or on the brink of it. So what are their other needs? And that really had us create a program called Community Connections, which now is the ancillary services that patients may need. For example, workforce development or training, access to food, access to clothing. We did a coat drive with one of our hospital partners and raised 700 coats for our patients 2 winters ago. So we understand that their needs are much greater than the medical needs, and it's complicated, and we're here to serve as much as we're able to with our various partners.
Yeah.
What we know really works is being in a community or a market area, if you will, here in Harrisburg, Dauphin County, and the surrounding areas once a week. So we're here twice a month in Harrisburg. We're looking at the opportunity to perhaps expand and add a clinic site in one of the peripheral towns, perhaps Camp Hill has come up, so that people from the rural areas can access as well. Yeah.
Great.
Yeah, the other thing you should know is that we have hospital partners here that ensure that we're able to do what we do. So our hospital partner here is Holy Spirit, and we're deeply grateful to Sister Romaine and her team for allowing us to continue to do our work, because they support us. So in addition, Pinnacle Health provides us with a diabetic educator on clinic days to make sure that our diabetic patients
have access to the nutritional information and can be, can maintain their health in a productive way. One of the things I wanted to mention is that about half of our budget is in-kind donations.
Okay.
So from hospital partners, lab, MRIs, those things are all given to us for free. And I think that the reason why, I know this because I've talked to a lot of CEOs of hospitals and different things, because they see us as their partners in making sure that the needs of the community are met, and we're able to do that at a lower cost of delivery than going to, say, the ER. So if we keep our patients who are chronically ill, multiple chronic illnesses, on their meds, coming and seeing us every 3-4 months as needed, we keep them out of the ER.
Exactly.
Yeah, so that's good for the community, it's good for the family, it's good for everybody. So.
Sure.
Traditionally in the past, when we first started, we thought it would be the homeless. And then we learned actually they have health care through the Medicaid system. And then we saw that there was a sliver of people who made too much money to qualify for Medicare and didn't have the resources or maybe even access to health care through their employers, or perhaps they were self-employed. So we started serving those who were uninsured and what we would refer to as the working poor, people who were working every day, trying to make ends meet, working 1, 2, 3 jobs, but just didn't have access to health care. All of this has been retrofitted. When the van first arrived, of course, it was stripped out. So we have a cabinet maker who gave us a very, very friends and family discount on the cabinetry and built-ins. So you have this area here, you have a nurse's station here. This here, which I think is probably one of the most interesting things you'll note, is that this is our pharmacy. So we were started by a pharmacist, and her thought was to make sure that we can provide healing through love. That's God's love. We're a faith-based organization, and how we could do that and restore dignity, how we could do that was through medicine. So she got together with doctors and brought together all the talent and resources of medical teams. And the formulary is fundamental to our program, because when somebody comes here, if they have to leave and go find their medicines, oftentimes that's a barrier to care. So if we diagnose them, but they have no way to treat that diagnosis, we're doing them a disservice. So we feel like the pharmacy is an important component of our program. So when patients arrive here, they typically come on an appointment. Most patients have an appointment. When they leave here, they leave with their next appointment in hand if they're chronically ill. So we have patients who deal with multiple chronic illnesses. So we put them in a regimen of coming every 3 to 4 months to be seen. But they leave with about 2 medications in hand and prescriptions to get their next medications, either through the Walmart programs, $4 programs, inexpensive, or in many cases through our indigent drug program. So we do an extensive indigent drug program here where we process all the paperwork with a very talented volunteer to make sure that they can access their inhalers, their diabetic meds, all of those very costly medications for chronic patients that would be a barrier to them being compliant and healthy. Okay. So about 70% of our patients are chronically ill.
Wow.
Okay.
And you'll serve anyone regardless of geography or how about means? What is the?
We don't ask our patients to prove their poverty, because our mission is to restore dignity, and you can't restore dignity if in the same time you're asking people to prove their need or their poverty. In that moment, the shame that someone deals with to have to prove their need is profound. So we don't do that.
Okay.
We don't process any paperwork, and we don't take any government money, because if we did, it would require typically us to either charge a sliding fee scale, right, or to process that paperwork. Right. One thing I want to mention is, we think of a sliding fee scale or a copay as, a small portion that somebody can pay. I was chatting with a patient who shared with me a story. She said, every month I get $710. She said, every month my rent is $700. Every month I get to decide how I'm going to spend that $10. Yeah. So where we think $10 copay is nothing and they should be able to pay that, for many, many of our patients, that $10 puts gas in their car, gets them to work, puts a meal or two in their bellies, puts shoes on their feet. So
we know that this is part of providing care for people who are on the brink of poverty. Let me show you the back here right quick. Well, this Dr. Sullivan's working with a patient right now. So this is one area here, and then Dr. O'Farrell, this is the back area here. So we're able to get 3 patients on board, and then we often have one or 2 practitioners in the church. So depending on how busy we are in the need, we can ramp up our capacity to serve, you know, the folks.
That's great.
Yeah.
And the number of times that you're here a month, is that enough? Are there plans to? Would you like to expand if you could?
Hold on one second.
How long of a waiting list is there for appointments?
There is no waiting list. People can either book an appointment or come in as a walk-in.
Okay.
Sometimes, if it's an acute illness, they can just walk in and be seen. If it's something where we might, and I don't know what scenario, maybe Dr. Sullivan could speak to that better, but it might be something where they just need a refill on meds or something like that. They may book them out for 2 weeks. This is, no need to duck. This is Dr. O'Farrell.
Hi, what's your name? Nice to see you.
Mayor Pappenfuss. He's the mayor of Harrisburg.
Oh, I'm glad to meet you.
Thank you. I'm getting a wonderful tour.
Yes, and so do you want to share why you volunteer for Mission of Mercy?
Oh, well, yes. I like to practice medicine. I've been doing it since I was like 24 or 5 years old. But I'm a retired Navy surgeon, and I retired at 62 and couldn't get a job in this area where we want to live. So I looked around for something interesting to do. And I met them at the walk.
And boy, was she a great find.
Oh, wow.
But I met you at the walk.
Yeah, I remember.
Was it Hack?
Yes, we do that Highmark walk
High
every year.
Mark walk
Mm-hmm.
at 2 years ago.
Yeah.
And I went to work the next day.
Yeah, it was so great. And you know, being a faith-based organization, we know God always has a plan and He always provides. So thank you for being here.
I've been looking for a job, you know, something to do that was interesting.
Sure.
Yeah.
Yeah, because I wanted to work part-time.
Yeah.
And this works really well.
That's fantastic.
And I like the work. I'm a surgeon, but I'm becoming a pretty good general doctor.
I can imagine.
But they've helped me with things that I haven't done since medical school.
That's good.
Yeah.
Really good.
Yeah, so we have a diverse group of practitioners who bring their knowledge and expertise. So we've had neurosurgeons, we've had who drive a mobile van. I mean, it's just really whatever we can do to make sure the needs are met.
Yeah, I'm a colorectal surgeon, but now I'm doing general practice.
Well,
but if you have hemorrhoids, I'm really
okay.
I'm all over it.
We at the 6 locations we go to, we have about 70 nurses that volunteer with us, and like you said, Jen, most of them come from the communities that we're working in that day. They hear about us through the churches or whatever, and they volunteer, and most of them never leave. It's sometimes hard to even have a new opening for a new nurse that wants to come in, because so many of our nurses stay for years and years and years and love it. Some of them are retired, some of them take off a day of work once a month to come and volunteer with us because they love it that much. We have great nurses.
Since the Affordable Care Act came into place, there were people who were uninsured who now have access to insurance. However, something that became clear to me was that an insurance card does not mean access to care. It's an insurance card. Now you still have to have a doctor who accepts that card. You've got to have the means to get there. So whereas we've moved some things forward, there's still people who are coming back to us saying, I can't get in to see a doctor, they won't take my Medicare or Medicaid card. So I think that how we frame it is we're part of the solution. We want to work with the hospitals and the primary care docs, and if we can help take care of folks for free that would otherwise have to either do without, which we're seeing a lot of people statistically right now, because they have insurance, but they have very high deductibles, very high copays. Dr. Sullivan? Okay, this is his office.
Hello, doctor. Nice to see you. Yes.
Mayor Pappenfuss.
Hi.
Dr. Sullivan is our chief medical director and oversees not only this program, but also oversees all the doctors in Arizona and Texas.
Oh.
Yeah, so we have a program in Arizona and Texas as well.
Yeah, we've been on the road the longest. In fact, about 21st year, but Arizona's been out there for 17, and in Corpus Christi, Texas is about 6 or 7 years, I think.
Okay.
Yeah.
Great. Do you go back and forth regularly, or
No, we're
it's
not to take care of patients. I mean, I try to make a visit a year, and then we have cell phone, or not cell phone, conference call meetings,
Sure, okay.
medical oversight committee meetings and stuff like that, where we all participate in that stuff together. Yes.
How has the new layout of this van assisted in patient care?
Well, you'd have to see the old one to know. We were in our 8th year, in our 8th winter, and everything, was wearing out. These type of vehicles aren't made for the kind of traffic that comes on and off of them. With that door opening and closing 100 or more times a day, and much more privacy. We have 3 separate exam rooms, all with exam tables on them. Much more room for the pharmacy, and I think the patients walk in and they see that this was what was done for them. They realize that most all of our people here are volunteers, and that the organization felt it was important enough to have a better, more suitable office to provide them privacy and dignity, and I think that you see it in their eyes when they walk on this the first time after they've been on the other one for so many years.
Can you share, Dr. Sullivan, what you're seeing now with the Affordable Care Act in terms of the impact on patients?
Sure. Before the Affordable Care Act, it was pretty easy to separate who we take care of and who we don't take care of. We're here for the uninsured. If we either help somebody get insurance, Medicare, medical assistance, or they got insurance through, say they got a job and got an employer, then we can encourage them to move on to more comprehensive care that we can even provide. Then when the Affordable Care Act came, no one knew for sure how are we going to fit in. Are there going to be patients to see? Is there going to be a change in our patient population? And what we have seen is that so many of the people who did exactly what they were supposed to do, they signed up, they have now got a premium which they may or may not be able to afford, but even if they can afford the premium, they cannot, their deductibles. It's basically like being uninsured because they got deductibles that could be $4,000 or $5,000 or even higher, $1,000 per year. So they're essentially uninsured. So they can't go see their doctors even though they're considered insured. By being insured, it has knocked them out of the indigent drug programs that we were able to get high-cost medicines for. So that's one problem, is that they don't have access even though they're so-called insured patients now. So it's not so easy anymore because a lot of these people, are finding themselves left high and dry with something that they can't afford. Most private doctors in private practice won't take the time and effort to fill out these forms to get those high-cost drugs that they might be eligible for, because it just slows them down. So they just won't order them, even though they may have been well controlled on these medicines. Then there's the problem of just access, because doctors have shut down their practices. Now I can't speak for all of Harrisburg. I know in Maryland there's one practice that covers half of Frederick that will not only not take self-pay, they will not take any new Medicare or Medicaid patients. They won't take them. They shut them. So these people are left then back to the emergency room, which at most they may get 5 or 6 days worth of medicines, and then they're back with nothing again. And then the third big problem we see, so we're having to make a case-by-case decision on allowing these people that are so-called insured to come back because they can't get the help they need. 2 other problems we're seeing is there are too many primary care doctors, internal medicine or family practice doctors, who sort of selectively decide what they're going to treat. I've had 2 patients in the last week who got on their Affordable Care Act, went to see their assigned primary care doctor, and their assigned primary care doctor says, well, I want you to see a rheumatologist for this, and an orthopedist for this, and chronic pain management for this, and an endocrinologist for this. So they can afford maybe the co-pays for their primary care doctor. They can't afford to go see all of these specialists, and that primary care doctor won't take care of all of those problems. Or that primary care doctor in his group or her group refuses to write any controlled drugs. And we take care of a lot of patients who are failed surgeries, bad trauma patients that been in shock trauma. They've got chronic pain, problems that are real. They're not problems that they're drug seeking. These are real chronic pain problems that are never going to get better. And too many practices, too many internal medicine and family practices are saying, we will not write for any controlled drugs. You have to go see pain management. Well, their insurance doesn't cover pain management, or it is so expensive, or it is so far away, and some of these people don't have transportation. So they end up back here and saying, well, my primary care doctor will take care of my diabetes and my blood pressure, but he or she won't write any chronic pain medicines. And we're seeing that across the board everywhere we go. There's no one specific place, but to some degree or another, that problem is pervasive. And I'm sure it's not just Maryland and Pennsylvania and the little piece of this that Mission Mercy sees. I'm sure it's probably all over the country. People are running into those same problems.
Dr. Sullivan, could you speak to a Harrisburg patient anonymously that you've seen that would really give Mayor Papenfuse an idea of the reality for our patients right here in Harrisburg? I'm thinking of the gal from the last clinic day here who was having trouble getting access to a doctor. She had a heart condition, I think.
Well, we have one. This is very unique. And I don't want to say too much, but there's one patient that we see here that is, in a program where she's being protected by the state because of something that she witnessed. And this person travels 3 hours by bus to see us because there is nobody that will see her in her area. And she does that, it's cheaper for her to take the bus than to try to get health care any other way. And I think that here we also see a lot of people from multiple countries. I mean, several of the African countries and a lot of Hispanic patients. So I would say this site is almost like the United Nations on some days. Maybe in there today, I haven't seen the waiting room today. Yes. But it's a large group of people. Most of the people, we have a French and a Hispanic interpreters here, but other people from other countries, they'll bring a family member that can speak for it. But we see a lot of cross-cultural type patients who really have no care. They have absolutely zero access to care unless they go to the emergency room. And they're not eligible for it. I mean, they would probably never be eligible for citizenship, or they're maybe here visiting a son or daughter for a year or two and then going to go back to their country, and they have no access to care. So we see those, hopefully get their chronic problems unstable and at least give them a regimen that it is likely that if they have any care in their country, that those drugs would be available, rather than picking a medicine off the shelf that the drug rep put up there that's the new drug on the block. It's great to give them a month or two, but when they go to buy that medicine, there's no way they could ever afford that medicine, rather than dealing with the generic drugs and the drugs that we can get for them through the energy drug program.
Yeah, I understand the critical role that you're playing. With the Affordable Care Act, have you seen some successes where people that used to come were able to get insurance and were able to move on to more comprehensive care? I understand that there's a lot of gaps and a lot of problems. But
I haven't seen that many, because if the ones that did may not have came back. Initially, everyone thought that once they had it, that they couldn't come back here anymore. Which was the ideal, that they would be able to have insurance now and go on. But what they're finding out is that that's not the case, and now people are finding out, well, we are on a case-by-case basis. We're not trying to take any money out of any practitioner's pocket, because we don't even bill. We don't have a mechanism to bill. And our lab and x-rays are even free, provided to us by Holy Spirit Hospital. But at the same time, if somebody is in desperate need of something, we're going to do what we can do to help that person and not be concerned about whether they're considered insured or not, if they don't have access or they don't have.
Well, I think that's a really important message to get out, because I think a lot of people have gone out and gotten insurance and are probably really struggling with co-pays and access, and to know that they can come here and not be judged and not be billed and get quality care. That's going to bring, I think, a lot of people comfort. So,
but the thing that we would want them to do is they really need to call and try to schedule for a month or two out, because we're
I do get that sense. We're going to have to push for potentially more days in the future.
Well, we would be open to that. We're very open to that. Now, the one thing I will say is what we need is we need to make sure that we have the funding necessary to support our operations. And so it costs us about $200,000 a year to run this practice here in Harrisburg. So anybody who would be interested in supporting in whatever way they can and is appropriate for them, we would appreciate the support.
Good.
So right now we're here 2 days a week, 2 days a month. We would like to be here once a week. Not at this site. We would stay here maybe 2 days, and another more peripheral site somewhere around Harrisburg that would attract a different population.
I understand. I think that would make sense. Yeah.
The other thing, Dr. Sullivan, I think one more point that is really important that we need to state is the patient advocacy piece. You are a patient advocate for disability when they need it and such. Can you speak to that? Because I think that's a very important piece.
In order to apply for medical assistance or in order to apply for Social Security disability, you have to have a doctor involved to initiate that process. That doctor, for like medical assistance, it would be impossible to get an MRI or to get medical assistance to get an MRI. And you would be at the bottom of the list forever. But if somebody like us is able to get you that MRI and it proves that you've got a blown out disc, and you can put that and be the practitioner that does the paperwork to submit with that, it's much more likely that person will get medical assistance to get that problem taken care of. So it requires a doctor, which most of these people could not afford to get a new patient appointment at an internist or a family practice doctor, or if they did, they would probably get triaged out to several subspecialists that they couldn't afford, so they wouldn't get the studies done to document that they have the problem that has to be documented before they're going to either be considered for medical assistance or Social Security disability. So, we provide that missing link, not only to get the tests to document it, but also to do the paperwork to get them plugged into the system to see then if they are eligible for medical assistance or Social Security, or sometimes to get the surgery that they need that allows them to go back to work. Like say somebody just has a gallbladder, or somebody has terrible pain, needs a hysterectomy. We're not talking about somebody that's failed back surgeries 10 times. They're not going to probably go back to work anyway. But we're talking about people that have treatable problems. I would say a really big hernia. A person can't work. He's a construction worker. If he can't get that hernia fixed, he's not going to be able to work. Psych patients, if they can't get the medicines that they need, they're going to disrupt their family. They're going to disrupt their community. They're going to probably not be able to be employed. So with the medicines we can get, plus the high-cost ones that are available through the indigent drug programs, which we can get on a one-on-one basis, but get them for like a year at a time, we're able to keep people with mental health problems a lot more functional than they would be if they were just floating around out there.
One last thing, the 12 free surgeries a year from Mercy Hospital, because that applies to Harrisburg patients, doesn't it?
It really hasn't. It would be nice if somebody up here would make the same offer. Mercy Hospital in Maryland, it's in Baltimore. They will provide us, up to 12 free inpatient or outpatient surgeries a year for those people who either continue to get denied for medical assistance or continue to get denied for Social Security disability, which is almost a given. Everybody gets denied. I don't care, if your arm was hanging by a string, you would probably get denied the first time and then have to get an attorney and then have to fight it. But they will do those kind of cases, and I try to reserve those for people that have a treatable problem that is curable by surgery, like the gallbladder, the hysterectomy, something like that will allow them to be healthy and functional again. And like I said, we would greatly appreciate such a relationship with one of the hospital systems up here, and we're very selective. We're not trying to overburden anybody. Same way with subspecialists. We could certainly use a variety of subspecialists who would be willing to see one patient a month or 2 patients a month in their office so that they could do an office procedure. It might be an office treadmill, something that doesn't involve the hospital. The hospital is being generous to us already. It's something that they could do in their office, or a dermatologist who might be able to do a biopsy, or a podiatrist, or a chiropractor, or something like that, so that we put a cap on it so they know they're not going to be overburdened, but that would be willing to to see 1 or 2 people a month for a specific problem that would expand the capacity of what we can provide.
And physical therapists.
And physical therapists we have room for here, and we have the equipment. We very much, with all of the chronic pain problems that are out there, it is helpful for us to have a physical therapist on site. And the other thing that is very important, I almost forgot, is that we provide full comprehensive $1 million, $3 million malpractice coverage to any either person who is works for somebody self-insured, so they wouldn't cover them, or retired doctors. So any licensed health professional who is retired but maintains their license, and a lot of them do maintain their license, even just to take care of their own family, we are able to provide them full comprehensive insurance, and that allowed us to maintain our dental program. And a lot of doctors now, because of just the climate in medicine, are retiring younger. You know, it's become a hassle, they don't need the money. And so there may be some very talented people out there that if they knew that they were covered by malpractice, would love to volunteer. And so we would like to get that word out.
Well, let's get those messages out, because I'm sure there are a lot of people that would like to help. We just need to know how.
Okay.
Thank you.
Very
good to see you.
Nice to meet you.
Wow.
Wow. Fabulous.
Yes.
Thank you, Mayor. Thank you
Thank
so
you.
much for taking the time today. It really means a whole lot to
I'm
us.
incredibly impressed, and it's very
Thank you.
helpful to
Thank
me,
you.
and I have a much better sense of what you're doing. So
Spread
thank
the
you.
word.
I will. I promise.
Thank you.